Of course, one foundation's effort is never enough. You have to find many partners who feel the same way. I am honored to announce today that the Chinese Ministry of Health has begun a new project here in China in partnership with our foundation to develop, demonstrate, and scale up new innovations to fight TB. The rise of tuberculosis around the world has had a powerful impact here in China. The WHO estimates that China has 15% of the world's TB cases, 1.3 million new cases a year, and more than 200,000 deaths annually. In addition, China has more than 20% of the world's drug-resistant cases, the second highest rate in the world. This is at a time when the government of China is intensifying its commitment to global health. In January, as the Vice Minister said, the government announced a $130 billion initiative to improve health care here in China. Because of its skill and its scale, its TB burden, its love of innovation, and its political commitment to public health, China is a perfect place for proving out large-scale use of new tools and delivery techniques to fight tuberculosis. As part of this new project, the Ministry of Health and our foundation will introduce these new diagnostics and new forms of treatment and new approaches to help patients complete treatment. This will all align with the new health delivery systems that are part of the health reform being developed here in China. At first, we'll test these new tools and systems against a population of 20 million people. After 2.5 years, then we'll scale up the most effective approaches to 100 million people by the end of the 5th year. At that point, we expect that the partnership will have demonstrated how to slash the incidence of tuberculosis and multi-drug resistant tuberculosis here in China, and that these techniques will be scaled up not only here in China, but around the world. The partnership is based on a clear premise. The alarming threat of drug-resistant TB is rising because of gaps and mistakes in the way we treat TB. If we improve basic TB prevention and control, we will cut off XDR-TB at the source. The Chinese Ministry of Health is committed to using the diagnostic tools I've described that let us know in hours, not weeks, if patients have TB or MDR-TB. This can dramatically reduce the number of people who pass the disease during the 6-week gap that exists today between diagnosis and treatment. So these tests will make a huge difference. We'll also be changing the systems. If the systems don't change, even great tools may not have a big effect because they won't get to the people who need them. One of the great benefits of this partnership is its commitment to simultaneously try new tools and modify systems. And this is a key reason I have such high confidence in this project. The Ministry of Health will also make it a priority to purchase and deliver fixed-dose combinations to reduce the number of pills patients have to take. As you know, if you don't complete the course of treatment, you're far less likely to recover, and the strain of TB that comes back is more likely to be drug resistance. So everything should be done to make it easier to complete the course of medicine. Fixed-dose combinations have been available for 30 years, but I'm stunned that still only 15% around the patients use them. A number of barriers have blocked their use. It's harder to assure the quality of FDCs, and that's increased the cost. There hasn't been a high-volume manufacturer, and so the incentive to innovate and bring these prices down has not been there. Also, with this limited number of manufacturers, the overall cost is still much too high. I think the thing that has really been missing is the lack of urgency from the global community to make fixed-dose combinations the standard of care. The government of China, by switching to FDCs, doing the quality assurance, and guaranteeing large purchase will break through the barriers that have kept FDCs so underused. If every country represented here would also commit to using FDCs, we could in the next 5 years see the vast majority of all patients on FDCs, which would lead to far better compliance and a reduction in the spread of TB. Finally, the partnership with China includes new ways of helping people complete their treatment. Financial incentives for doctors monitoring patients will be improved. Right now, healthcare workers at the township and village level are expected to monitor patients to make sure they're taking their medicine. But the financial incentives are low enough so that workers often do other clinical work that pay more. Research shows that in some area, only a small minority of the patients have trouble complying with treatment. So if we can take those 25% that are most at risk and focus the intention and incentives on strong follow-up with that 25%, it will allow for far higher compliance and allow this to be done for a reasonable investment level. So the partnership will evaluate the use of technology-based approaches such as mobile phones and medicine monitors. This will help people comply and identify the people who don't, and let doctors with less effort move them to more intensive case management.